Hello everyone. Today we will discuss evidence-based treatment recommendation for GERD in adults. So first you should know Hello everyone. Today we will discuss evidence-based treatment recommendation for GERD in adults. First, we should know a little bit about level of evidence per grades of recommendation and strength of evidence. So what it means if level of evidence is high, it means further research will not likely to change out the confidence in the estimate of effect. The level of evidence is moderate. Further research would likely have an impact on the confidence in the estimate of effect. The level of evidence is low. Further research would be expected to have an important impact on the confidence and would be likely to change the evidence. Strength of evidence, if the strength of evidence is strong, desired effects of the intervention clearly outweigh the undesirable effects. If strength of evidence is conditional, there is uncertainty about the rate of within desirable and undesirable effects. So let's move on to evidence-based treatment recommendation for GERD in adults. First, we usually talk about lifestyle modification. So based on evidence, let's say if the patient recently gained weight and developed GERD, then weight loss in overweight GERD patients, the level of evidence is moderate and the strength of evidence is conditional. Elevation of head end of the bed with nocturnal GERD symptoms, the level of evidence is low and strength of evidence is conditional. What about elimination of food that trigger acid reflux is not recommended in the treatment of GERD. The level of evidence is low and strength of evidence is conditional. Let's talk about acid suppressive therapy. Treatment of choice for symptom relief and healing of erosive esophagitis is 8-week PPI course. The level of evidence is high and strength of evidence is also strong. When we talk about delayed release PPI, they should be administered 30 to 60 minutes before meal for maximum pH control. The level of evidence is moderate and strength of evidence is strong. PPI should be started at once daily dosing prior to first meal each day. The level of evidence is moderate, strength of evidence is again strong. Flexibility with mealtime administration may be seen with new PPI, for example, dexlansoprazole. The level of evidence is moderate and strength of evidence is conditional. When clinically indicated, PPI are considered safe in pregnancy. The level of evidence is moderate and strength of evidence is conditional. Patients with osteoporosis can use PPI. Level of evidence is moderate and strength of evidence is conditional. PPI are risk factors for development of C. diff. Level of evidence is moderate and strength of evidence is moderate. PPI can be used in patients on Plavix without risk for adverse cardiovascular event. This is a good one. Level of evidence is high and strength of evidence is strong. Let's talk about maintenance therapy. Maintenance therapy is recommended for number one, patients having continued symptoms after PPI is discontinued. And number two, patients who have complication like Barrett's esophagus or erosive esophagitis. So in these two kind of patients, maintenance therapy is recommended. Patients who are having continuous symptoms after PPI discontinued, and second patient who have complication. So when we talk about evidence and strength, the level of evidence is moderate, but the strength of evidence is strong. The lowest effective dose should be used when long-term PPI is indicated for maintenance. So level of evidence is actually low and strength of evidence is conditional. When we talk about, so H2 receptor antagonist can be used as maintenance therapy in patients without erosive disease. It means that they do not have Barrett esophagus, they do not have erosive esophagitis. So H2 receptor antagonists can be used when the goal is to relieve heartburn only. The level of evidence is moderate, but strength of evidence is conditional. The next thing is surgery. Surgery is the long-term treatment option in GERD patients. The level of evidence is high. Strength of evidence is also strong. So if the patient is not willing to take medical treatment and the patient is developing complication, then surgery is one of the options in GERD patients. Surgery is not generally recommended in PPI non-responder. The level of evidence is high and strength of evidence is strong. Surgery is not generally recommended in patients with extra esophageal symptoms not responding to PPI. The level of evidence is moderate. Strength of evidence is strong. So this was evidence-based treatment in patients with GERD who are adult. Thank you very much and have a nice day.